And let's just take a moment, everyone, to just be in awe that our bodies can heal themselves. Like, that is just amazing, right? That you can tear a muscle and it can heal itself, that you can have decreased range of motion and you can heal yourself, that you can scar down on different tissues. So that's just amazing to begin with.
I agree. Yeah.
Go bodies.
Go bodies, yes.
If you have weakness in your hips, the chances of you developing lower back pain, hip pain, knee pain, and even having an ankle sprain significantly increases. So just like Christina had mentioned earlier, your hips are just like the shoulder blade of the upper body, right? You always want to be working on your hip strength.
To remember the why behind everything and base it upon your life. You know, if you go to the gym and you're feeling unmotivated, well, think about why you decided to start in the first place and the things that you want to be able to do, and then start making those correlations.
But we also have to respect that. You know, we can't push the body and say, well, you need to heal faster, because no matter how much you want that, it's not going to happen. And if you continually tend to push yourself before you are fully healed, really you're just setting yourself back for more time. You are spending more time on the bench, you're spending more time out of your sport when you try to push your body past its abilities.
Welcome to Only the Greatest Podcast. If you're feeling stuck and unsure what to do next in your fitness journey, we might be what you're looking for. My name is Philip. I own and operate OTG Fitness, which is a private personal training gym on the south side of Houston in Webster. I do this podcast every week with my best friend, Daryl. We've been friends since third grade and working out together ever since. Also joining us today will be Sean. He's the one that makes this podcast not only sound great, but look good as well. Our goal here is to help Houston make its way up the ladder of health and fitness. So if you're in the Houston area and ready to become the greatest version of yourself, be sure to like and subscribe on your favorite podcast platform. Dr. Christina and Dr. Cameron from Elevated PT are making a return to the podcast today to discuss the physical side of the fastest growing sport in America. If you are a pickleball player that has suffered an injury or looking to prevent one, today's show may be of great value to you. We also discuss the best practices to optimize performance on the court and keep you healthy for a long time to come. We put a ton of work into this podcast and do nothing to monetize it. A 5-star review would be greatly appreciated to help us continue to grow and spread the message of health and fitness in Houston. If you're listening and would also like to watch the show, be sure to check us out on YouTube and subscribe for weekly episodes. Dr. B.
Hey.
And Dr. Christina. Thank you so much. Back on the show. I hope you like your nickname. I don't know if anyone's called you that.
I did have one person call me that.
Oh, very nice. Yes, I like it a lot. Well, I really appreciate you guys coming on together this time. We're going to be discussing something that can hopefully help a lot of people out. And I'm just going to go ahead and say it. I played pickleball once 2 weeks ago, and I feel like an expert. So I'm coming to y'all.
Are you addicted now?
With the facts. Yeah, I do. I've been wanting to play again for sure. It's just been a time situation now with Denver. We thought that her not having a job would free up a lot of our time, and it hasn't at all. So, I mean, it's just a different, it's just been a transition period for us. Since that happened. So, but we did play a couple weeks ago. It was a lot of fun. We really enjoyed it, and we want to continue to play as a way to stay active. And I see why people like it so much.
Yes, it's a really, really fun activity. It's easier to lower barrier to entry for a lot of people, and it's very social. So you meet a lot of friendly, nice people, and make friends that way.
Yeah, I think the number one thing for sure is that lower barrier of entry, because I remember trying to play tennis when I was younger, and Denver actually played high school tennis, so she's pretty good at tennis. And the last time I played tennis, I would say, I'm spending 30 minutes just to start hitting the ball effectively, right? Yes. But with pickleball, you can just kind of go out there and be playing, and you're playing in no time.
Yeah. I've probably played less than 10 times myself, and I'm going to be in a tournament this weekend. Not competitive. It's all friendly. But
what's on the lines?
What's on the lines?
Yeah. What do you get for winning?
Any money,
I
blood?
think there is, but it's a charity. It's a charity tournament.
Okay.
So, you're paying an entry, but you're not winning anything.
So everyone wins.
Everyone
in
wins.
this situation. Yeah, I like that. But yeah, I mean, it is a lot of fun. I do enjoy it, and I know there's a lot of people playing. And I've even had, and they're usually like, seems to be like a lot of seniors play pickleball, but anyone can play of any ages.
Oh yeah.
And maybe as we're talking today, we can talk specifically about like a senior demographic versus someone younger as well. Maybe they see obviously different issues while they're playing. So I'd like to maybe discuss that a little bit. But I have had some people come in and talk about different issues. It usually is like a knee thing I'm remembering now, because as we were talking before, once you said that, I actually remember a lady, I'm not going to say any names, but I remember a client that we had, actually two. One was a lower body issue and one was an upper body issue, both pickleball.
Gotcha.
And so I hope that we can talk about some things that will help a lot of people today.
Definitely. It is a growing sport. You know, a lot more people getting involved in it every single day. They've got professional teams now. You know, someday we'll probably see it in the Olympics. So I think it's a good time at the beginning of a sport or early on in it to talk about how to prevent injury.
Oh yeah, for sure. And I've even been found myself watching some on YouTube, you know, watching the pros, you know. So like I said, I'm coming to y'all from an expert point of view today. So be ready.
You're just peeping out the competition, really.
That's all that's going on. Yeah. And I'm trying to make sure I optimize myself for the pro tour, you know. So
I love it.
All right. Well, what we discussed was kind of breaking this down to a few different kind of body parts. You know, the common places that people get injuries. Right, in pickleball. So maybe we can just start one at a time and maybe start in the upper body. You mentioned the elbow. So maybe answer for us, what are the common elbow injuries that happen? And if someone's listening to this that is suffering from one of those, then we can kind of break it down, what to do about it and how to get back to safety, you know? So whoever wants to answer, you know.
So as we discussed earlier, I'm the talker between the two of us.
I didn't notice.
And so, you know, I'll definitely, in the elbow, there are two common injuries that are common to both tennis and pickleball. I think that when I was speaking with someone earlier this year about, you know, why they loved pickleball, they said, oh, it's great because I don't get injured. And then later on down the line, they were like, actually, we do get injured. It's just, again, that lower barrier to entry, and it may take longer for that injury to set in because there's not as much required for the sport, right? For those who've never played, the court itself is like half the size of a tennis court. Most of the game, especially with, you know, really competitive people, is going to be played very close to what they call the kitchen, which is that front square. So rectangle, really. So you're not moving around a whole lot. And I have a friend who plays, and he's probably, they rate pickleball players on a scale of 1 to 5, and he's probably, you know, pro level, even though he wouldn't say so. And this guy, he does not have to move his feet. He will just plant his feet. He does not have to move once he's at that kitchen, and he can just handle the paddle and angle it in the right ways to get the ball to hit right where you're not standing. So that's why, you know, the people who get really good at it, you know, they love it because, yes, there is maybe less injuries overall once you get really good at it, but as you're first getting into it and you maybe are hitting the ball harder than you need to, you are swinging your arm more than you need to because you're used to the idea of tennis, not pickleball, then that's where those injuries will come in. So in the elbow, like we said, there is a medial and lateral side of your elbow. Medial being the inside. If you were holding your arm out in front of you, palm up, that's going to be the inside of your elbow. Lateral is going to be the outside of your elbow. So I'll talk about the lateral injury, and then I'll let Dr. B talk about the medial since it's also a common golf injury. Laterally, the outside of the elbow injury is going to be where most of your, what we call wrist extensors attach to your common extensor tendon. So any of the muscles that lift your hand backwards are going to be there. And when you're playing pickleball or tennis, you're mostly going to use that when you're doing a backhand swing, okay? You're not supposed to use it, though. People end up using it because they lack control of their shoulder blade, actually. I'll educate people that just like your core is the powerhouse of your body, that's what people will say, and that's where all your power and force comes from. For your arm, that is your shoulder blade, or your scapula for a more technical term. when you move your arm in any way, your shoulder blade should be initiating that movement, and it should be continually moving with you. So in that backhand, you should have started it with your shoulder blade already in a down and retracted position, down and back. And then as you swing that paddle, you should be continually squeezing that shoulder blade further, so the power is coming from your shoulder blade. However, like I said, most people get out of practice of that, and they'll start to overuse their wrist itself. So on that backswing, they'll hit the ball and then use the wrist to add the power rather than using the shoulder blade. I get it. I do it myself too whenever I'm first learning pickleball right now. But when you learn to control that shoulder blade, it's not only going to reduce your pain, you're going to notice that you get more power than you ever could have out of your wrist.
I was just about to say, I feel like not only is it a better way, it's a much more efficient way as well. If you actually think about the power production, that's happening there. Because if your wrist, like look at this little bit of range of motion I have from my wrist. If you're relying on just this wrist, you might get some spin on it. Right. You're not getting any speed or power.
Right.
Right.
And do you even want the spin?
I don't know. Well, yes, you want. Yeah, no, yes. I do not want the spin.
As the person receiving the ball, no, I don't want you to spin on that.
Yeah, but it makes total sense that your arm as a whole can create so much more power.
Correct.
Than just the wrist.
Correct. So, common signs of that people might notice outside of pickleball when that lateral portion of your elbow is hurting. If you are gripping something really tight, you're lifting your groceries, you might have pain there at that point on the outside of your elbow. If you're writing, writing with a pencil, if you're typing and you type a lot on the computer, those are common things that you might start to notice. Hey, the outside of my elbow's hurting, and oh yeah, I just started playing pickleball about a month ago. Maybe I should call Elevated PT.
Oh yeah. So it sounds like half of this is going to be half of making this better is going to be practicing the movement itself.
Correct.
Is that right?
Well, it's going to be first learning how to isolate those muscles, because when you haven't talked to your shoulder blade in a while, you forget how to do it. When you're trying to use that shoulder blade and depress it, push it down, you may cheat with your latissimus muscle. You may cheat with your back, doing back arching extension rather than strictly using your lower trapezius to pull that shoulder blade down. So first we have to get you to understand how to do the movement isometrically without compensating with other muscles. Then we go into, okay, now let's use that to move, and you have to continually isometrically contract that muscle as you're moving. Now that you can move with no resistance and not hitting something, now let's add in hitting something or add some resistance. And each of those steps, it's probably going to be a little bit of a regression. You forget how to use your muscle again, but you build it back up and you move on to the next step.
Do you have any tips on how to start making that happen? Let's say I'm having this, or even if let's talk about injury prevention now, even if I don't have this, but what you said just resonated with me. Like, what should I do to start practicing and start to feel that shoulder blade working, and how do I work it isometrically, by itself?
Totally. Easiest exercise that you can start with is going to be scapular retractions, okay? And if you're watching this on YouTube, then you'll be able to see what I'm doing. If you're not, then go watch it on YouTube.
Yes. Amazing. What a plug. What a plug, Sean. Yeah.
But what you're going to go ahead and do is, usually when I tell people to squeeze their shoulder blades, it's going to look like this. They're squeezing like up and back, right?
Okay.
And you can see Dr. Cameron doing it as well. But what we want to get you to do is, I'll always start with, okay, instead of squeezing first, I want you to first focus on pushing your shoulder blades down away from your ears, okay? You should feel muscles right below your shoulder blades contracting, all right? Then once you're pushing down, now you may squeeze just enough that you feel your chest open up. You don't have to squeeze super hard and now you're arching your back to compensate, just enough that you feel your chest opening up. You can also think about it like kiss the bottom corners of your shoulder blade together. Do not kiss the top corners together, which is what most people do. So that is the easiest way to get started learning how to isometrically contract your shoulder blade in the way that it should move for pickleball, in the way that it should move for really any of your shoulder movement.
Yeah, I was just thinking as you're saying that, how often this is needs to be done in the gym. Like when you're exercising, which we'll talk about a little bit later as well, like particularly like gym-based exercises, I guess, that people can be doing to prevent injury. But it's a very similar situation. It's like getting the body into the correct position that it should be. And whether you're working out or you're doing an activity, it's often the same. And that's like the benefit of working out, right? It's like that muscle memory of doing it. So do you recommend doing this like as a warm up, or do you just kind of do it throughout the day randomly?
Well, definitely when you're first starting off, you're going to do it throughout the day randomly. You want to do it as many times as you can because you're trying to build a habit. You're trying to build a muscle connection. So do it throughout the day, all day long, anytime you're thinking about it. Really, it's a good posture for you to have anyways. But as you get better at it and you don't have to think about it so much, then yes, using it as a warm up either before you do exercises at the gym or before you go ahead and play to remind your brain, hey, we're about to use these muscles, kind of wake those up, get those working, knock on the front door and say, hey, we're here, we're about to work out, we're about to do this. And then, do other dynamic warm-ups and you can get into your activity.
Yeah, perfect. So outside of the elbow, we want to make sure that we're perfecting our backhand form.
Yes.
Hitting from the shoulder, not
Yes.
from the wrist, retracting the scapula,
Yes.
big chest.
Correct.
I do have a question about actually like hitting the ball and everything. Is it more of like a push or is it like a actual smack? Like when I've never played either.
So again, you have to consider the difference between tennis and pickleball. So the ball itself is different, right? A tennis ball is, hard and it is continuous. There is no holes in it. Pickleball is much more like a wiffle ball. It's got holes in it. So one, the airspeed does slow it down, okay? So even if you hit it really hard, it's not gonna go as fast as a tennis ball would. So oftentimes if you talk to, again, people who've been playing for a long time, they tell you that as you get really good, you learn that you don't need to put that much power behind it. It's really more of a lift or more of a whole body movement. So yes, you can use your shoulder blade to prevent that injury, but if you want to continue to improve the power and the accuracy of your swing, then you want to start getting your whole body into that swing too. So if you can learn to use whole body mechanics, then you're going to be accurately aiming that ball better and getting it over the net how you want it to. Hitting it as hard as you can is in the long run not going to get you the results that you want from pickleball.
Yeah, I remember that from tennis. I grew up playing baseball. And so the top spin thing in tennis would always get me. I'm sure it's like a wrist issue or something. I don't know. I've never been taught how to play tennis, but when I would play tennis, I just hit the ball over the fence all the time. I was like, man, if this was baseball, this would be great. But it wasn't. So I was just losing all the time. But all right, well, let's talk about the inside of the elbow. So what's going on there?
So same principles apply, except in the inside of the elbow, that's going to be your wrist flexors. So cocking the wrist this way if you're watching on YouTube. And so that would be more for the forehand. So whenever you're coming across this way, if you're cocking your wrist, or even if you are gripping that paddle too heavily, that can cause the medial epicondylitis or the lateral epicondylitis. It can cause either one. But if it's your wrist flexors, you are going to feel it a little bit more over here. There is a common flexor tendon that attaches up here in the ulna. And so same principles apply. Scapular strength is really important and scapular control. So not only do you want to strengthen those muscles, but you want the neuromuscular control to be there. And so that you don't have to think about it as much and it just automatically kicks on. It's just like second nature. And so not only does that principle apply to, elbow injuries, but that if you have good neuromuscular control of your scapular muscles, it decreases your risk of shoulder pain, of neck pain, of upper back pain, and it really kind of sets you for success in lots of different areas.
Yeah, and I know that you guys aren't like actual pickleball experts. We're talking about like you guys are physical therapists, like helping us through this thing. But when you're hitting a ball, whether it's pickleball or tennis, should the wrist be locked?
Should in neutral?
Yeah, like in a neutral position?
Yes.
Okay, at all times. And so if you do that, you'll be in a better spot.
Yes.
You'll be a more accurate hitter and your body will be safer. Is that accurate?
Yeah, and I mean, the muscles in your forearm are a lot smaller than the muscles in your shoulder girdle. And so it's smarter to use your bigger, meatier muscles than it is to try to utilize your smaller muscles to try to get that power.
Yeah, and then that little bit of angle, like if you're just consistent with the angle of your paddle, right, you're going to be a much more accurate hitter. Which is kind of like whether it's forehand or especially backhand, because feels less natural, to most people. Can we talk a little bit about the over gripping thing? Like what's going on there? And I have kind of a follow-up gym question to that too, probably. But like over gripping, I know can be an issue. We hear a lot in the gym world, talking about when you over grip things like during pulling movements, people often all they feel is their forearms, and maybe some elbow pain, which is what we're talking about right now. But why is over gripping something? Like, why does that cause a problem over time? And what exactly is going on when you over grip?
So it's not only in the gym world and tennis world and pickleball world, but also in golf and in baseball. If you grip too much, then you're too rigid. You're like a robot, right? And you're not going to have that fluid motion. And whenever you're having so much of a strong contraction in one area, that's where your brain goes. Your brain is now turned on and highlighting that area and really focusing on what's going on right there instead of what's going on with every other part of the movement that I'm trying to do. And so then when that is kicked on into high gear and your brain is continuously telling it, like, fire up, fire up, fire up, and then, of course, it's going to get fatigued. And then once it gets fatigued, it starts to cramp. And then once it starts to cramp, then you start to get pain. So
is this similar to that? I don't know if you remember when we talked about running, we talked about the repetitive motion injury. Would that be comparable here? Because you're just constantly gripping.
Yes.
That piece of the equation eventually fatigues.
Yeah.
And now something else is going to go wrong to make up for that.
Exactly.
Correct. I like how you did like a little callback and you just kind of showed that like this applies everywhere, you know. We've really been getting more into educating patients on just like the principles of different parts of exercise and body mechanics and things that you can apply across the board once you understand the basic principle of it. But just to add, since pickleball is, like you said, it is for all ages, right? And a younger person, the grip issue may be an issue because they've got to type at work or they're a student and they have to carry a heavy backpack or things like that. That's where it's going to be an issue for them. But an older person, when they're having grip issues, usually, if you look into the data, they've shown that grip strength does have a direct correlation to longevity of life. So, I think that if you look at it, it leads to functional independence if you can grip and lift things on your own and you don't have to depend on other people to do it for you. So overgripping is a problem, but you can also work on building your grip strength and endurance. So if you are overgripping and you're like, I can't stop myself from doing that, well, then we need to slowly build your strength and endurance for that so you can tolerate that.
Yeah, it's so interesting. You hear the word grip strength all the time, but I've never heard grip endurance, which in the gym we talk about muscle endurance, right? So it's the same thing. But yeah, grip endurance is so important, to be able to do it over time. And I think another interesting thing I'm kind of making a correlation to is to just last week, Sean and I were talking about how in the gym, often people don't work out to be better exercisers. And so it's so important to compare what we're talking about when we're in the gym and working out to activities that you do want to become better at. And this is what I was just talking to our team at the gym about this the other day. When we're talking about form on exercises and progressions and regressions of things, we have to remember that people do not exercise. Some people do. Don't get me wrong. We got powerlifters in the world. We got bodybuilders in the world, things like that.
Right.
Most people, though, do not exercise to become better at exercising.
Right.
They are exercising to get better at something else, to either live longer, be stronger, hike further, play better pickleball. And so it's important to learn these principles, whether they're in the gym or in a therapy room, and then go apply those to actually make them better at their activity or whatever skill that they're trying to get better at.
Definitely. And you said something earlier in this specific interview that we're doing right now, and I can't remember exactly what you said, but it brought up in my mind, and you're bringing it up again in my mind, that I've started telling patients when they tell me, well, I feel really great when I'm doing the exercises with you. But for example, I had a patient who did a lot of gardening the other day, and she had a lot of neck pain and upper back pain afterwards. And I said, well, were you thinking at all about how you were lifting? Were you thinking at all about kind of comparing it to an exercise? She was like, well, no. And I said, from now on, I want you to think of every single activity you do for every part of your day as what exercise is this similar to? And she does go to a gym on a regular basis, so she knows a lot of different exercises. So I said, when you were picking up that soil gardening, that's a row. You're doing a row. So do it like a row. When you were shoveling, that is a dumbbell lift. So do it like a dumbbell lift. Treat these daily activities like you would in the gym, and you're going to feel better.
Yeah, it's so funny you say that. You know what comparison I use when something that a lot of people struggle with is the hip hinging situation, right? So like doing
Yes.
a deadlift, people really struggle with it. If they ever exercised before, I like to use the term body awareness. Their body awareness is just very low, things like that. So once they get it and they're learning, I always tell them, I don't care if you drop your keys on the ground. I want you to get your feet set, keys right between your toes, hips back, back straight.
Yep.
You reach over to
Lifted
pick
belt on, chalk on hand.
everything. Let's check all the boxes.
Yeah, right.
And we're laughing, but it matters. And something that I've really noticed is when people exercise regularly, they just kind of do it, even though obviously we're making a joke about it right now, they do kind of do that.
Right.
They do it anyways on their own, and now they're safer.
Right. I mean, I know that Cameron laughs at me, but I tell her, like, if I skip working out for a couple of days, I can, even just 2 days, I can already tell that it is harder for me to pick my sons up from the floor. I can tell. And, when I've gone on really long vacations where I'm going to be hiking for a long period and I'm wearing a backpack and I'm like, man, why is my shoulder hurting? And then, well, of course you need to do that scapular retraction that we just talked about earlier in this episode. And I hold that scapular retraction for, the next 5 to 10 minutes. All of a sudden my shoulder pain is gone. And then I work on keeping that up for the rest of the time. It makes such a big difference.
Oh yeah. And especially it accumulates over time as well. It's cumulative. Dr. B, do you have a specific exercise for that medial elbow situation going on there? We talked about for the shoulder, the scapular retraction, right? But do you have maybe another one that we can throw in there?
So same principles really apply to both. So having that good scapular control is going to help decrease your risk of having the elbow issues, and then start the rehab process. So we're going to start with the whole shoulder girdle in addition to the elbow. And so whether it's medial or lateral epicondylitis, you want to make sure that your wrist flexors or your wrist extensors, whichever side is the problem side, are nice and flexible. So stretching and making sure that you're stretching gently. You're not wanting to overstretch it and cause any more inflammation. And once everything is nice and stretched out, then you want to work on eccentric control of that muscle group.
When you're stretching the forearm, does having your elbow locked out help at all? You always see that, right? People are like doing this number here. Like,
right.
Is that helping me at all? Is that good for the elbow, bad for the elbow? Does it matter whether I'm going either direction?
Yes. So you have some muscles that pass the elbow joint. And so by straightening it out, it will stretch those muscles as well.
Which do you prefer, elbow bent or do you want to do elbow straight all the time?
I kind of do both. It just depends on the area of pain. If their pain is more distal than proximal, then...
Can you explain?
Sure. So if the pain is further from the elbow, closer down towards the wrist, then having the elbow straight isn't as...
necessary?
Yes. Compared to if it's more proximal, meaning more closer to the elbow joint itself, then you for sure want to do it with the elbow straight. But it just kind of depends on their tolerance and location of pain. And sometimes we'll do both.
Yeah, I think speaking on tolerance is very important for sure, because the first thing you said was not to overdo it, but a lot of times like, oh, okay. It's just like go all out. So like you can work your way into these things, right? Slowly over time. But of course, in a situation like this, and we talked about this before the show, one thing I want to make sure that we touch on here is I understand that when people get into a new sport or a new activity, they're very excited.
Yes.
They want to play. Maybe it's been a long time since they've been competitive. Right. So it's about preventing injury and overcoming injury. Sometimes a slow process.
Yes.
So before we move on to the kind of the lower body stuff, do you mind just touching on that a little bit? Like how, once I'm pain-free, right? Okay. I'm having this, medial elbow, pain.
Right.
I'm doing my stretches. I'm doing my scapular retractions. I feel pretty good. I'm going to go play tomorrow. Can we talk about like what recovery actually looks like?
Right. Yeah. We were talking about this definitely before the show, and we said that we were going to give kind of some specifics because it's important to know like what is normal time for your body to heal. Of course, we've come up with some really cool treatments these days, PRP injections, stem cells, platelets that can help to improve the speed of recovery a little bit. But it does still take your tissues time to heal. And let's just take a moment, everyone, to just be in awe that our bodies can heal themselves. Like that is just amazing, right? That you can tear a muscle and it can heal itself, that you can have decreased range of motion and you can heal yourself, that you can scar down on different tissues. So that's just amazing to begin with.
I agree. Yeah.
Go bodies.
Go bodies, yes. But we also have to respect that. We can't push the body and say, well, you need to heal faster, because no matter how much you want that, it's not going to happen. And if you continually tend to push yourself before you are fully healed, really, you're just setting yourself back for more time. You are spending more time on the bench. You're spending more time out of your sport when you try to push your body past its abilities. So we know from research that if we're talking about a bone injury, you broke a bone, it's going to take 4 to 6 weeks to heal. And that's why usually when people are in casts, it's usually 4 to 6 weeks that they're in the cast. If we're talking about a muscle, and that includes tendons, however, if you're talking about a tendon, it may take a little bit longer. It's going to take 6 to 12 weeks to heal. 8 to 12 weeks to heal for a muscle. And then when you're talking a ligament, it's going to take more like 12 to 16 weeks to heal. That's just the truth of it. And it has to do with blood flow. You have the most blood flow in your bones. You have the second most blood flow to your muscles and your tendons. And then your ligaments are, left with a little bit less blood flow compared to all the others. And your blood does bring that healthy oxygen and those white blood cells that help to do the healing process. They are the ones that do the work that help your body heal, create new cells, get rid of bad cells, cause that tissue to go back to what it was before. So again, they're doing their job. You need to do your job and allow them the time to do theirs.
Yeah, I think what you started with is so important, because we often do, as soon as we feel good, we just want to get back to it, and respecting what is actually going on. Like if you think about, my bone was broken and my body can heal it.
That's pretty amazing.
That's pretty amazing. And it only took 6 weeks?
Yes. Yes.
Like, if you think about it in those terms, it's still like not a big deal, instead of like 6 weeks before I can do anything.
Right.
These are just completely different mindsets.
Right. Or, we don't have to go get a joint replacement for every single bone break that we have, right? When you were a kid and you broke your arm, you didn't have to go get a new arm. You got to keep that. But we have to respect that then you are living the rest of your life with that, and you have to respect the healing process as it's happening.
And keep in mind that those time frames that Dr. Christina listed, those are for people that have normal healing. And not everybody has that. If you have diabetes, if you smoke, if you have poor nutrition, if you have autoimmune diseases, or if you're taking a medication that impacts your immune system as well, then that time frame is going to be longer. So you have to take that into account too, that those time frames are for quote unquote normal healing times, or average healing times for a normal healing person. Yeah,
and anyone could definitely take longer as well. Even if we're talking about averages, you're still going to have people outside of the norm,
Absolutely.
On a regular. And I think it's really interesting too. I've never thought about it in that manner. I'm familiar with some of these time frames, but I never thought about the root causes, the blood flow situation. So that's really interesting.
Yeah.
Speaking of some of the, if you don't mind talking on some of the things that can heal you faster, you mentioned PRP, which I'm a little bit familiar with. Are these things that you guys recommend only as needed? Is it something that if someone's really been struggling with something for a very long time, like what's your process look like to determine situations like that?
Understood. So, it's always going to depend on the person's goals, right? If we're talking to a professional athlete who needs to get back, as soon as possible to their sport, then yeah, you're going to go ahead and take all the measures that you can to heal as fast as possible. But they're also going to take the measures to make sure that they don't overdo it either. If we're talking about someone who just got injured, I would not tell someone, hey, go get PRP injections right now, go get stem cells. Well, let your body do what it is made to do. And then there are things that we can do to support that. Doing massage, right, or manual therapy, it's going to bring blood flow to the area. It stimulates blood flow, so we're bringing those healthy cells. We also do dry needling, and other providers do as well. Dry needling brings more blood flow to the area as well by causing a micro trauma in that area and triggers that healing process. You could even do what they call with the needling. It's going to sound a little crazy, but we can sit there and do bone tapping with the. I know, I see your eyes. It is not as like, I know it sounds like, what the how's that going to feel? It just feels weird. I'm going to tell you that I've had it done to me.
I mean, I feel weird right now.
Sounds like a Saw movie or something.
What's going on here?
But again, let's think about, okay, blood flow is what does the healing, right? If you do bone tapping, you are causing a micro trauma on the bone. You're going to bring blood flow to that area. That can help to build collagen in joints that don't have a whole lot of cushion there anymore. It can help to bring blood flow to a area where the muscle is torn, and it's going to increase that blood flow. And like I said earlier, that's where a lot of your blood is anyways, in your bones. So you're just harnessing that ability of your body. Now, if you've been dealing with something chronically and it's not going away and you've tried all these things, then yes, talk to your provider and say, would this be a possibility for me? Of course, you're going to have to consider other things. Not everyone's insurance covers it. Do you have the financial means to do that? But I've had patients who've done it, and usually they do it in combination with physical therapy. You do have to take some time off to, again, allow your body to heal and fully absorb those things. But we do it usually in combination, or they'll do it afterwards, and I've seen it help. I've also seen it do didn't really do much, but I've never seen it have a negative effect.
Yeah, that's my experience as well. I've never done it. Personally, I've never done either one. As far as PRP or stem cells, the two kind of specific things that we're talking about right now, right? Mm-hmm. I've heard amazing stories from it.
Right.
Almost miracle types of things from people I know as well, like personally. And then I've also heard, man, that was really expensive and it didn't do anything.
Right.
Yeah.
I mean, you're taking that risk. You are. But like I said, at least knowing that neither of us have seen, or Dr. B have seen, a negative effect from it.
Yeah.
So, taking away the fear of, oh gosh, is this going to make things worse? Well, no, but we can't guarantee it's going to make it better.
Right. I agree with that. Anything else on those two things before we kind of move on to away from the elbow and maybe into the knees?
I don't think so.
Okay. Well, let's go into the knees now. I know that in pickleball, like you said earlier, there's not quite as much movement, but I think that something that happens a lot here, and you guys can correct me if I'm wrong, but my opinion with the knee situation, also probably the ankle, is pickleball is attracting a person that hasn't done this type of movement in a very long time. And I'm thinking that maybe that's why these injuries are a little more common. Mm-hmm. I'm not sure if you guys agree with that, but kind of maybe if you don't mind sharing your thoughts on that statement, as well as telling us a little bit about something that can go wrong in the knee with the pickleball.
No, I completely agree with what you said. I mean, it's just kind of like an entry level sport that anyone can really pick up on at any age, which is always nice to have. But whenever you are trying out a new sport, your first thought process isn't like, oh, I'm going to go to the gym so that I can try out this one sport. You're first going to go out and see if you even like it. And then once you like it, then you're like, oh yeah. And then, you keep playing. And so you've probably been deconditioned. And so it does put you at an increased risk at that point.
Yeah. During the podcast where we talked about running, we talked about the importance of cross training, right? And I think that runners are really good about talking that, but I think other sports aren't necessarily. I don't hear the word cross train as much, especially in the pickleball community. You should be cross training. You should be strengthening when you're not playing pickleball to prevent these injuries. And it's the lack of conditioning. It's also, again, the lack of neuromuscular control, not knowing how that movement is supposed to feel, what proper alignment is for your body. A lot of people don't know that, hey, your knee shouldn't be falling in as you move sideways, or it shouldn't be out too far where you're rolling your ankle out. So, even just educating people on what proper alignment looks like, and this is really what it should look like, people can make huge changes just by changing that habit.
Yeah, and speaking on what Dr. B was talking about, which is when they first start, they don't go to the gym first, or they don't do any type of preparation. They're just like, all right, give me that paddle,
Yeah, exactly.
And then they play their first game and they like it, and now that excitement, the same thing that I was talking about earlier, where when you get hurt and you just started the sport and you want to get back to it, well, the same thing when you first start, you just hop right into it, and maybe you're not ready. How long has it been since you've done something like this? This is not very common. So let's say I am that person, I go out there. What's something that could go wrong, or something that I want to prevent from happening with my knees?
Yeah, I think what we've been hearing a lot of is pain on the outside or the inside of the knee, right? Again, we're talking about that medial, which is the inside, the outside is the lateral. And so again, it's that lateral, that side to side movement that people will do. It's less so than in tennis, especially if you're playing with a partner, right? Then you're only going to have half the court to cover anyways. But it still is, there is still some side to side movement. And like I said, if you don't know what proper alignment is, if you haven't been working on your hip muscles, we don't want to strain those smaller knee and ankle muscles. We want to work on those hips and get those nice and strong so that they can support that side to side movement and lead it. Just like your shoulder blade should be leading your arm, your hips should be leading your leg.
Couple of follow-ups. You said the word alignment a few times. Can you maybe break that down for me? What do you mean by alignment? What's aligning in the lower body? And why it's important, you know, specifically?
So if anyone's looking for some new Scrabble words, there's genu valgus and genu varus, which is what we're going to talk about.
Those probably get a lot of points.
Roll right off the tongue.
So genu valgus is basically when your knees are falling in towards each other. And it could be one knee, it could be both knees. And genu varus is when they are too far outside of being right in line with your hip and your second toe. I usually tell people you want those knees in line with your second toe if you're looking at your feet, and you want it in line with your hip if you're looking at that. If you're allowing that knee to push out too far or push in too far, it's going to be straining not only the ligaments that connect your knee there. You've got a medial collateral ligament, you've got a lateral collateral ligament. And if anybody who's listening has ever torn their ACL and maybe has also torn their MCL, that medial collateral ligament is what we're talking about. And so it's going to strain those ligaments. It's also going to strain your most outside quad, your most inside quad, your adductors, your hamstrings. It's going to cause a lot of issues. So we want to work on your stance of keeping things in alignment, and not just that, but usually people are like, well, I can't stay in alignment because I feel locked out in my hips. Well, we need you to sit back more. So we're going to be in that low squat position. That's another alignment part of it. So, yes.
So the alignment you're speaking of is hip, knee, foot.
Yes.
Right? We want that alignment. Can you give me an exercise for each issue, the inner and the outer? Let's say I have the valgus situation going on. What can I do about that?
So you're going to want to look at your hips first, just like you looked at your shoulder blade first up top. You're going to look at your hips first down low. There's lots of options out there, and I can't really demonstrate any of them on camera.
We'll do our best. We'll clip in a video or something.
We'll describe. I guess like the easiest one to get into would be standing exercises, standing leg raises. So you're standing at your kitchen counter, let's say that, and you're facing your kitchen counter. All right, you've got your standing leg, let's say your right leg, and then you've got your left leg, which is going to be your moving leg. When you are going to move your leg to the side, I want you to squeeze your bottom first before you even move. Then I want you to squeeze your bottom even more in order to lift your left leg to the side. Now, I do cue people, you don't want to just go straight to the side, because given most of us compensate with our quads and our hip flexors, you're going to be tempted to let the leg go forward. I like this exercise in front of the counter because if you're kicking the cupboard in front of you, you're doing it wrong.
Yeah, I understand. Okay. Yep.
But you want to lift in kind of a side and backwards diagonal direction. You should be feeling this muscle contraction on the outside of your hip. Not in the direct back where you think your glutes are, but in your lateral glutes, so the most outside part of your hip is where you should be feeling this contraction. And there are compensations that you want to watch out for. It's good to have someone watch you do it who knows what they're looking for, because you may think you're doing it right, and you're like, yeah, I'm doing exactly what you described, and then, but my back hurts. Why is my back hurting? Well, we can watch you and educate you on that. Typically, that would be because you're cheating with like allowing your trunk to side bend as you're lifting. So no trunk movement, strictly hip, and making sure that your leg isn't coming forward. That would help with specifically if your knees are falling in too far.
If so I'm facing the counter, right? Does it matter if I'm bent over a little bit, like at the hips? Because I feel like maybe my counter's a little low, maybe I'm a little taller. Like, do I need to really focus on standing up tall when I'm doing this? Is it not that important? Like, what?
I would say that, you know, if you have to be bent over, that's okay, just as long as you're making sure that with your knees being bent, when you're lifting that leg, that you have that leg straight.
Got it.
The one that you're lifting is straight. You do not want to have that knee bent, because then you're probably going to be tempted to cheat with your hamstrings.
And is adding to this range of motion something that's important as well, or how are you thinking about that?
You will get more range of motion when you get more control naturally, but the range of motion is not the goal of this one. So that's why you're only going to raise your leg as high as you can without your trunk side bending to make up for lack of range of motion.
Without tilting, right? Yeah.
So I would say like shoot for no more than like 45 degrees out to the side. Because if you go any further than that, like
you're going to have that tilt.
Yes, because your hip joint should only go about 45 degrees into abduction. So if the goal is to go in your full range, then for sure don't go past 45 degrees. But even a lot of times you should feel it by 30 degrees. You know, it's not necessarily about the range of motion. It's about doing quality movement.
It's about it's about feeling the muscle activation, right? Can it be helpful to add resistance to this, like with a hip band or something like that?
It can. Now, you always want to start, with the band up higher, so above your knees and doing it, and then kind of work your way down as you get stronger. You don't want to start low first because, again, you'll probably lose your mechanics once you add that much resistance. One other point I'd like to make is your standing hip should also be burning, okay? If you are contracting that lateral glute, outside glute muscle as well, while you're lifting the left leg, my right hip should be burning as well in the same exact area. If you are not feeling burning in your standing hip, then you are not contracting that glute enough to stabilize your standing leg.
And we should do an equal amount on each side, right? Or if we have one that's worse than the other, is it okay to do extra on that side, or should you just always keep it the same?
I mean, I think that, the exercise community is kind of moving more towards going to fatigue with good body mechanics. So I would say, go until fatigue, right? Do your sets and reps. We usually say, start with 2 sets of 10, then 3 sets of 10, then 3 of 15. But I've been educating people. We say that because 10 should be so hard that you need a break.
If you do it right.
If you do it right. And if it's not hard and you don't need a break, that's when it's time to increase resistance or increase sets and reps. Or like I said, you could just think about, I'm not going to count how many I do. I'm just going to do it until I'm tired while maintaining good form. If you're losing your form because you're tired, you need to stop.
Perfect. What about if my knees are going out? What if I have that issue?
Yeah, so if they're going out, then we're typically going to focus on strengthening your adductor muscles. And those are the ones that are on the inside of your thigh. Think about it like adding your legs together. And so for an exercise like that, you can do it in standing as well. With that one, you'd probably want to start with some resistance, actually. So a TheraBand or a cable column that is going to be wrapped around your ankle or your knee. You could start with your knee, and then it's pulling you, that TheraBand or that cable column is pulling you to the side. So it's pulling you out, and you are pulling against the resistance in. Okay. Now, again, we don't want to cheat with our hip flexors or our quads, so we're not going to let that leg come forward of our standing leg. We're going to bring it directly together. Now, that exercise, I would say, I don't want you bent over.
Okay.
I want you upright, because if you are bent over, again, it's going to make you want to use your most forward muscles in your adductors versus using the whole group. So you want to be as upright, you want to be in neutral in your posture, squeezing those legs together.
So you want to tie a band to something low, right? And you want to walk laterally away from that until your working leg is forced up to that 30 to 45 degree angle, and then you bring them down together. Right. Similar protocol, couple sets of 10 to get started.
Right.
A lot of muscle activation, right? You're not going in front. You're not going behind. You're not trying to increase range of motion. You're just bringing it together.
Correct.
Slow and controlled, eccentric, I'm assuming.
Yes.
And then nice, good pull back into position.
And then that standing hip should still be burning on the outside.
Right. Got it. Okay. Perfect. So knee pain, inside, outside, check and see if you have that in that caving in or going out, right? And then you can do these exercises. And I'm assuming these exercises are great even if you don't have knee pain.
Oh, yeah.
But
Absolutely.
if you're getting started in a laterally moving sport, you can consider doing these things.
Correct.
And actually, hip strength is super important to any of your lower body joints. So if you have weakness in your hips, the chances of you developing lower back pain, hip pain, knee pain, and even having an ankle sprain significantly increases. So just like Christina had mentioned earlier, your hips are just like the shoulder blade of the upper body, right? And so you always want to be working on your hip strength.
Yeah, it's constant constant improvement.
Yes.
You know, over time, even someone that's in the gym trying to get stronger, that can be a limiting factor, right? We hear that a lot. So.
Oh, yeah. And I think, you know, the longer you're in the gym, I think some people will sometimes get a little, like, they almost start looking at it like, I'm getting bored, right? And of course, everyone's different, right? For me, I almost start looking for tiny changes, and I'll start to be like, oh, I can turn on that muscle a little bit easier than I could yesterday. Oh, I can feel the back fibers of it now. I can differentiate between the front and the back fibers. I can control, am I squeezing the upper part of the muscle or the lower part of the muscle? Like, I'm looking for more control in all of my exercises. That's my goal, but it's because I'm exercising for a functional reason. But yeah, I mean, looking at little changes is motivating too.
Yeah, we were just talking about this with the team again the other day, doing the same kind of meeting. I was talking about how people don't exercise to get better at exercising. You know, people don't in the gym. The fundamentals are the fundamentals, and sometimes it does feel a little boring. And even myself, I can look back at a video of me doing, let's use bench press for example, from like 5 years ago. I might not be a whole lot stronger now, but I can feel it so much better. I can feel the chest muscles working better. I can make a very small adjustment and I know what's going on in my body. So like maybe the muscle hypertrophy is actually a little bit better now than it was then, even though I'm moving the same. My technique is better. My form is better. You know, and so there's a lot of ways to
And I'm sure the carryover is better as well. Like you're able to use those muscles in your day-to-day life. If you're moving furniture around or you're doing whatever you're doing, you're able to utilize those muscles appropriately and with better activation than you probably were at that point too.
Oh yes, 100% for sure. Is there anything else within the knee, you know, that you kind of see issues with?
I would say that probably like anterior knee pain. So
that's what I was going to say.
Pain.
Okay.
So typically, like I said, like I kind of already mentioned, you know, we would work with you on sitting back into that squat position, that ready position for pickleball. You don't want those knees translating forward over your toes when you're squatting down. You want to hinge back, like you were saying, and keep those knees a little bit further back, almost like you'll feel like you're hanging on your hamstrings. Like that's what's holding you up. And that is going to protect the front of your knees from, again, endurance of being in that, you know, forward squat position for so long while you're playing.
Is there anything in particular that you recommend to kind of prevent that injury from coming up?
Super easy exercise that you can do to work on it is sit to stands, getting up out of a chair and sitting back down, but using it as an exercise. So practicing, how does it feel when I really hinge back as I'm sitting down? How do my knees feel? Great. And then when I'm standing up, I'm going to work on using my glutes to stand up rather than my quads.
Yeah, and you're talking about doing repetitions with intentionality.
Yes.
This is an exercise, in my opinion, that intentionality is everything. Because anyone can do it. You get up and down out of a chair multiple times every day.
Right.
Right. But doing it with intention, slowly, thinking about what you're doing, taking breaks as needed when the form breaks and things like that. This is one of those exercises where it's just above and beyond important to be able to do that. So 10 reps at a time in the beginning, maybe what you recommend, and then kind of work your way up.
Right.
Yeah.
Right.
And then maybe is there benefits to, once that's easy, go ahead and then start doing some loaded squats? What are your thoughts there?
Absolutely, as long as you're maintaining good form. And sometimes I'll even have patients do it just with a chair behind them where they're tapping their bottom to the chair. So they're still getting that cue before they're ready to take that away completely and just do body weight.
Yeah, that's one of the progressions that we use. We make sure that people understand the difference between a sit to stand and a box assisted squat.
There you go.
Before you go body weights, because you got sit to stand where you kind of all the way down, right, all the way up as needed, and then we get them as low as possible while doing a sit to stand, and then it's time to go. Maybe you need to bring the height up just a little bit more again to go to just a box assisted squat where they're maintaining control, you know, the whole time.
Right. And if you're not, you know, working out with resistance for the purpose of, I want to get as bulky as possible and build muscle mass and be in, you know, like a pro show. You know, I was talking to a patient the other day. He was talking about, I think I'm ready to start adding some resistance to these squats that we've been working on. I was like, great. And then he was kind of like getting to the point of like, well, how do I know when I've started lifting enough? Like, when do I stop, you know? And I told him, I said, well, it depends on your lifestyle. I know that you have a young child. About how much does your child weigh? And he said, oh, about like, you know, 35, 40 pounds. I said, great, start lifting progressively and make sure you keep your form up and slowly make your way up to 40 pounds. And then you'll know that you can pick your child up without having any issues. So just thinking functionality too, like what do I lift in my life? And if you're doing it for pickleball, well, maybe you work your way up to being able to lift close to your body weight because you're going to be in that squat holding up your body weight. So, yeah.
Yeah, it's so important to remember the why behind everything of like, and base it upon your life. If you go to the gym and you're feeling unmotivated, well, think about why you decided to start in the first place and the things that you want to be able to do, and then start making those correlations, Right. So, yeah, that's great stuff. Let's move on, maybe to the ankle. And that's the other one that you guys mentioned, very popular in pickleball, right? For the same reasons, I'm assuming. But,
sure. So any kind of sport or activity that causes lateral movement is going to increase your risk of having an ankle sprain, which is why having good hip strength and good hip control helps to decrease your risk of having an ankle sprain. And anytime that you have a previous injury, whether it's surgical, whether it's just an ankle sprain or a knee sprain or whatever it might be, any type of injury that has happened to a joint, the proprioception gets altered. So your body's awareness of itself in space gets altered. And so when that's the case, you're not able to appropriately make adjustments in the moment whenever your body's not focused on exactly what's happening only at my ankle. You're looking at the ball, you're trying to look at your partner, you're trying to do whatever it might be. And so your body's not only focused on what's happening at just your ankle. And so your risk of that rolling is a lot higher.
Is it possible to prevent ankle rolling? Like,
absolutely.
We hear that a lot, like in basketball is where I would be familiar, but obviously here in pickleball as well. Like growing up, I remember playing basketball and rolling my ankle. Like, is there ways that I can get stronger to prevent that from happening? Or is it just like bad luck?
I would say, you can have bad luck, of course, and accidents do happen. Mm-hmm. But there are definitely things to help decrease that chance of it occurring. So doing, like we mentioned, hip strength. Hip strengthening is really important, especially lateral hip strength. But also just working on your ankle mobility and your ankle strength, and then working on your proprioception. So you can improve your proprioception on your own. You can practice balance exercises so that your body knows how it's supposed to adapt to certain things that are kind of thrown your way. And it knows like the amount of movement to do, whether it's doing too much or too little, and how to correct that.
Can you give me an example of a couple of these balance exercises?
Sure. So you can do, it kind of depends on your activity level. So I always, whenever I'm testing, I start by testing if they can stand heel to toe. So we call that tandem. And if their balance looks nice and stable there, then we're going to go up to single leg stance. And then if they're able to hold that, we'd like to see at minimum 30 seconds of being able to hold that with your arms crossed.
Can you explain to me the tandem?
Yeah, so just like a drunk walk, if a police officer pulls you over.
Yeah. Gotcha.
So standing heel to toe.
Okay.
Making sure they're directly in line and not tilted out to the side or staggered like that. So that's kind of where I start. And then you can even increase it past that if you're on doing single leg stance. You can be on foam. You can be on a Bosu ball. You can be passing a weight around your body in a circle so that it creates some movement in your body, and your ankle is having to adapt to that and make adjustments and changes to keep you upright.
So a nice exercise might be, if you can't do it now, you just want maybe in a hallway or something like that, practice doing it consecutive steps over and over until you're able to.
Yeah, so you can do it walking, but you can also just do it statically. You can do it standing in a corner so that if you do fall over, you got a wall.
So you would just do it and you would just hold there?
Mm-hmm, with your arms crossed and set a timer and see how long you can hold it. Yeah. Minimum you want to do 30 seconds, but for my patients, I really like to see them up to a minute.
Okay. Yeah.
And balance is one thing that I love to talk about.
Okay, let's talk.
Balance and vertigo. And so, again, we've got the younger population that likes pickleball. We've got the older population. But if we're talking specifically to the older population that's starting to lose a little bit of their proprioception, like Cameron mentioned, things that you need to keep in mind that make up your balance, okay? Your balance is made up of 4 things. It's made up of what you can see. So visually, am I on an even surface? Am I on an incline? Am I on a decline? Am I on an uneven surface? Where am I? 2, your inner ear. Okay, so if you're having vertigo issues, there might be an inner ear issue, and that could affect your balance. 3, your proprioception, like Dr. B mentioned. If your ankle is not reporting back to your brain, oh, I'm kind of leaning to the outside. Oh, I'm kind of leaning to the inside. You've got more of your weight in your toes. You've got more of your weight in your heels. If your ankle is not reporting that to your brain, then it's going to be harder for you to recover when that ball comes at you. And then lastly, it's made up of your leg strength. If you're not strong, how are you going to hold yourself up, right? So, considering all those things, you also have to consider, like Cameron mentioned, we'd put you on an uneven surface. So if your sport was, let's say, not pickleball or tennis where you're on a hard surface, but golf where you're on an uneven surface, we're going to want to practice uneven surface issues because as you're walking on those uneven surfaces, your ankle is having to react to, oh, there was a little divot there. Oh, that was a little mound. Oh, we're not on a quite even surface here. And your ankle has to respond to all that. Now we can practice strategies with you to make sure that you prevent having injuries and ankle sprains. We can practice, like she said, the balance issues. And one of my favorite things to do to people as they get really good is doing what we call perturbations. So perturbations are where basically you're trying your hardest to balance, and I come up to you and I try to push you over.
Okay.
From all directions.
So I just get in the best position that I can?
Well, doing it in that tandem or that single leg or whatever position that
Nice
we're
little
working
stress
on.
relief.
Yeah, you just tackle them.
Now, I start, with like a fingertip tapping, right? And then we progress to, okay, I'm going to tell you that I'm doing side to side. Okay, now I'm going to tell you we're doing forward and back. We're working on that. Now I'm not going to tell you what position I'm pushing from. And I'm just going to do like finger.
Let you react, yeah.
Yes, but now I'm going to push harder and, we work our way up to it. But basically you can use different strategies there too. When people are not strong enough in their ankle, I'll cue them, okay, well, let's use your hips. So if I'm pushing you and you feel like you're going to fall forward, throw your hips back. If I'm pushing you from the right and you feel like you're going to fall to the left, throw your hips to the left, right? You can use different strategies besides your ankle to hold you up. But ideally, the stronger you can make your ankle, the better you're at your ankle strategy, the ankle doing the work to hold you up, not your hip or your arms grabbing something, then you're going to be able to prevent an ankle sprain.
You're more resilient.
You're more resilient.
Here's a bro question. Is there any advantage to like doing weightlifting in these positions? Let's say I get myself in this position while I'm doing like an overhead press or anything
absolutely.
like that.
Because the weight's going to throw you off in different directions, even if it's just a tiny little bit that you don't even realize is happening, especially if you're using dumbbells, which are a little bit more free weight, then it's going to throw your balance off just a tad, and your body's going to have to learn how to adapt to it. And so, we're talking about proprioception of the ankle currently, but even just doing like an overhead press with dumbbells is going to do the same thing to your shoulders. So your shoulders are having to learn how to adapt and how much force to put and what direction to push. And so the same thing is happening there too.
Oh, very cool. I do have a question that is related, but maybe different. Can you define for me a sprain? Like, what exactly does that mean? Like, if I roll my ankle, does that mean I sprained it? Right. Or like, what's the difference here?
Good question. So a strain, STR, a strain is going to be when you damage a muscle or a tendon. Okay. And there are different grades of strains, right? There's a grade 1, grade 2, grade 3. And so that's going to depend on how much of a tear was there. And then they'll describe, like, was it like a deep tear? Was it a cross tear? Was it a vertical tear? Like, there's going to be different descriptors. And all of those things are going to affect how long it's going to take you to heal. If you had a tear, but it was vertical along, with the fibers, it's going to take you less time to heal than if you had a cross-sectional tear across, and let's say you snapped your entire Achilles tendon. That's going to take longer to tear or to heal than a vertical tear in that Achilles tendon.
So a strain and a tear are the same thing?
The highest level of a strain would be a tear. Yes.
Okay.
Yes.
But even with the lower levels, it's micro tears.
They're micro tears.
Right.
That was my understanding, but I hear different people using it like different ways. So I was just curious.
Yeah.
And then, so what is a sprain with a P?
A sprain with a P is going to be when you do that same thing to a ligament. And ligaments are anything that hold bones together. So a lot of people don't understand the difference between a ligament and a tendon. A tendon is what holds your muscle to your bone, and a tendon is part of the muscle. A ligament is what holds bone to bone. So you're going to sprain your ligaments. And again, same idea, there's different grades, and you can tear a ligament. And the same thing, if you vertically tore it, if you cross-sectionally tore it, all of those things have factors.
And my understanding is that ligaments are much less flexible than tendons.
So
right?
technically tendons aren't that flexible either, but
Okay.
they're directly attached to the muscle, and the muscles are flexible. And so there's more give, and your tendons are a little less likely to tear because the give happens at the muscle, whereas the ligaments don't have anywhere to kind of put the force, and so it's just purely on itself. And they have a significant less amount of blood flow to the area, so they're just more rigid.
Yeah. When it comes to the sprains, the ligaments, I'm
Right.
assuming there's different grades as well,
Right.
right? So can we talk about the difference between because ankle sprains are something that happens to everyone.
Right.
At least at one point in your life, you have an ankle sprain.
Right.
Maybe it's severe, maybe it's minor.
Yeah.
Are there ways to speed up the recovery of that sprain?
So it's going to take, the time that it takes because of blood flow. We talked about, you could possibly do PRP or stem cells or dry needling. Dry needling will speed up that recovery because it kind of does the same thing by just using your own body's mechanisms to bring that blood flow to the area. Rather than having to introduce a foreign body to the body, you can use your own homeostasis, your own body's mechanisms to be in a balance. So you can speed it up that way, but like we said earlier, you do have to respect how long it takes for a ligament to heal. Now, as you're healing, we're going to be strengthening your muscles that are all around that, so the muscles can do the job that the ligament cannot do right now. So it doesn't mean that you can't do anything. It just means that, maybe we don't want you to go all out on the pickleball court when you've got a grade 3 sprain. Let's go ahead and work on your strength, work on your stability, and then when you're more strong and stable and your muscles can do the job of the ligament, now you can go and play again and still allow that ligament to heal while it's not doing the work the muscles are.
Mm-hmm. And what was the time frame on the ligament again?
Ligament is the longest, and it's going to take 12 to 16 weeks.
It's a long time.
It is a long time.
Yeah. And so and you're just kind of playing it by feel when you can do much of anything. Like 12 to 16 weeks is for full healing, right?
Right.
But at what point, or are you just kind of listening to your body through that point? Because I'm a big fan of as well, and this is not my expertise, so I'm asking you guys, but my understanding of a lot of pain management and stuff, tempo is something that, in my opinion, I've used with pretty good success for myself when it comes to pain management, like moving slowly. Like I can still do a lot of the same stuff. I'm just going to do it way slower, right? But how do I make that determination with a sprain? Because I just feel like this is something really common that happens.
We wouldn't even try to do anything that could possibly stress that ligament for the first 8 weeks.
That's a long time
Now,
to do nothing.
Now, let's say it's your ankle. It's not that you're doing nothing. We're going to be working out your hip.
Okay,
We're going to
gotcha.
be doing non-weight bearing exercises for your leg. Okay. And we're going to be maybe even not just strengthening your hip, but strengthening your foot. So that's one thing that we haven't talked about that affects the ankle too. If your feet are weak and you can't, use your feet to also help with that balance and proprioception, then your ankle has to do more of the work. So we can work out your feet. We can work out your hip. We can work out your knee. We can even work out the muscles that are opposite of that ligament that aren't going to strain it. But we're going to do all of that non-weight bearing for that first 8 weeks.
Would you recommend being on even if the pain is minimal, are you like on crutches during that time? Like, what's your thoughts on walking? Just the amount of walking that you should do.
Yeah, I mean, it depends on what the grade of the sprain is, right? But typically with a sprain, that's when you're going to see people with braces or, not usually like the soft ones that are just like compressive, but the ones that are actually going to, they're stiff and they're not going to allow your joint to move in the way that could cause it to hurt. Or if we're talking about ankles, you see people in boots at that point. So they're walking, but they are in a protective assistive device that is not going to allow them to move in a position that could cause further damage.
Let's talk about like a light sprain. I sprained my ankle playing pickleball. I mean, I can walk and just feel it a little bit. Do you think it's okay to kind of walk through that?
Definitely.
Yeah.
If it's a light sprain, you're hurting for a day or two, that's fine. The first 2 days of any injury are probably going to be the most painful anyways. I would just say at that point you can walk on it, but let's start strengthening the muscles that are weak so then you can get back to playing pickleball and not be worried about making it worse. Because if it's light, great. I'm glad it's light. I don't want it to get worse.
Sure.
It also matters how much swelling there is, in the joint, because anytime that there's swelling, it tends to turn off the muscles around that area. And so if there is a lot of swelling, then, obviously walking and standing on it is going to be causing even more pooling down there of your blood and fluid. But also the muscles just aren't as protective currently because there's so much swelling happening that it tends to turn the muscles off. So, yes, you can kind of walk it off and see how it feels, but I think, paying attention to how it looks and additionally to how it feels is important.
Yeah, that's a good term. Kind of takes me back to like high school sports. Walk it off. You know what I mean? So it's like, is that good advice? Like walk it off. Is that okay? Or should I take this thing more seriously? Obviously, take a look at it. How does it feel? Grade it on a scale of 1 to 10 and, kind of make that determination. Another question I had that we hadn't talked about, but something that I would like to discuss if you guys are okay with it is icing and heat.
Yeah.
And all injuries, but especially this ankle one and probably the elbow as well.
Right.
Those are 2 joints. I grew up playing baseball, so there's a lot of shoulder stuff in baseball. Talked a lot about ice and heat. So just curious, when is ice good? When is it bad? When is heat good? When is it bad? How do we make those type of determinations? I just feel like there's a lot of advice. You hear the rice is rest, ice. What is it?
Compress,
elevate. Yeah. So what are you guys' thoughts on that stuff?
So the recent research is now saying that basically you don't need ice. They are encouraging letting the inflammatory process carry itself out. So the new acronym is Peace and Love. Dang. And I can't remember what all it stands for.
Peace stands. I know it is a lot.
I was like, dang,
Sean's nervous.
I was like, rice was already a little bit.
Yeah, I already forgot rice. I actually haven't thought about this in a long time. So
we're going to test my memory while Dr. B looks it up. So we're going to test my memory. So P is going to be protective. So you want to still be protective of what you just injured. Don't go and walk it off immediately, right? Be protective. E is going to be for elevate. So we kept elevate.
Okay.
When there's going to be A, which is avoid anti-inflammatories. So you don't want to take Advil, ibuprofen, Aleve if you can avoid it, because like Dr. Cameron said, we want to allow that natural inflammatory process to happen. What is inflammation? Inflammation is red blood cells, white blood cells that are coming to the area to help healing. And if you are cutting that off by using ice or using these medicines that their whole point is to decrease that inflammatory process, then you're kind of shooting yourself in the foot for not allowing your body to take care of itself. So that was A. C is compress. We still want to compress because that's going to help with any swelling that Dr. B was saying. You don't want too much swelling that's causing it where you can't even move your joint because it's so swollen. And then the last E is going to be...
Educate.
Okay. Understanding more about what is the injury, why did it happen, what can I do to prevent this from happening again. L is going to be load. So that's when you start loading per tolerance, okay? Because we don't want to avoid using our body. It's healing at a good rate, and that's the only way we're going to know what we're capable of is if we load to tolerance. O is going to be optimization. Optimism. So you got to be optimistic.
Being positive.
Yeah. We all know that it's important that you're going to get better and you're not just like, oh, this is never going to get better. I'll never, ever feel the same again. Well, if you have that attitude, yeah, you won't. So you have to be optimistic that this is going to work out. V is vascularization. Yep. So promoting that vascularization with heat, using heat to promote, releasing any tension that you have in your muscles, but also to reduce any stiffness that's happening as well. And then the last E is...
Exercise.
Yep. The most important one.
Yeah, I like this a lot.
Awesome.
Yeah, I like this a lot. Can we talk just a little bit about the timeline of that? It sounds like the peace is kind of like the more immediate part, and the love maybe kind of comes a little later, is what I'm hearing here. But so can you just kind of speak on that timeline a little bit?
It depends on the grade of tear and all of that,
Yeah.
and whether it's a strain or a sprain. But I don't know. I don't try to give timelines to my patients.
Okay.
Christina might be able to give a little bit different perspective, but I really just kind of go based off on how they're feeling because I don't want to set them up for failure. I used to try to give, timelines, but then people would have that stuck in their head of like, oh, I'm going to be
that's
healed by the end of the month and I'm going to be able to go run my marathon, or even though I didn't say that.
They're bringing the old part in a little bit too early.
Exactly. And then it sets them up for failure, because then they get disappointed, and then they kind of go down this rabbit hole of like, oh, I'm never going to get better, and, all of that.
How do you feel about, I had someone tell me a long time ago that you shouldn't put heat on an injury because it only enhances inflammation.
That is what we used to tell people, yes, until the most recent research. But now we're really finding out that inflammation is not a bad thing. If it is not so bad if it's so swollen that you literally can't move your joint, okay, that's too much swelling, okay? Mm-hmm. That is too much swelling. But if it's just swollen and you can still move the joint per tolerance, then let your body do what it's supposed to do. Really, I would say that I only tell people to use ice if the joint is so swollen that they can't move the joint. Then, okay, you can use some ice, but I'll tell them alternate ice and heat.
Okay.
But really, I mostly recommend that people use heat.
I'm
nothing.
a huge fan of, I was going to say, I'm a huge fan of Epsom salt.
Yes.
Epsom salt soaking after like a run is the best.
Yes,
it really is the best. Like,
yes,
as hot as you can get it, and then you just kind of get your kind of
get in there.
Some calf raises in
You're
there.
speaking my language.
Oh man, it's the
Speaking my
greatest,
language.
dude. Yeah,
Just
yeah.
hot enough that it burns a little.
Yeah, for sure. Yeah. For
So
sure.
what I'm hearing here is when you do get hurt, assess the situation, avoid ice, move it when you can,
Yes.
add load, which I love. There's a couple things in there that I really love that I think people overlook. Obviously I'm a little biased, like, from as a bro, as a gym
Right.
bro, I
Right.
guess.
Right.
People, in my opinion, overlook the importance of loading their muscles
Yes.
and joints, like
Properly loading.
Properly
Yeah.
doing weighted exercises.
Right.
There's just,
Right.
it's good for mobility. It's obviously good for strength, movement, overcoming injuries, preventing injuries.
So let me give you
Yeah.
an example, a personal example of how I handled a situation where it was pretty acute. And I was like, oh gosh, like I'm going to have to use all my knowledge now to take care of myself. I was on a cruise last September with my kids, and we were on a beach, and I was rushing because I guess he was 1 at the time, had just had explosive diarrhea in the ocean. And I was like, oh my God. So I had to
happens to the best of us.
Does it?
He's going to listen back to this podcast someday and be like, Mom! But I didn't use his name, so it could be either one of them. Anywho, I'm rushing him to the showers, right? To the beach showers to try and clean him off, right? And I stubbed my toe really hard on a large, like granite rock that's there on the beach, right? And I am just convinced, I'm like, I just broke my toe. I broke my toe. I'm on vacation. I broke my toe. And my toe starts immediately swelling, turning purple. I'm just like, oh my God, I broke my toe. And so, I got to hobble back to the van that we're taking back to the cruise, and we get back on the cruise. And I had brought painter's tape with me because I had seen on TikTok or whatever that, if you bring painter's tape, it's good for any situation. So I was like, all right, we're going on a week-long cruise. I'm bringing painter's tape.
I thought duct tape was the answer.
Yeah. I didn't know that.
Yeah.
Painter's tape.
So I brought painter's tape, and I was like, okay, I've got painter's tape. I'm going to buddy tape my toes, right? I'm going to buddy tape my toes, and I didn't use ice. I put them together to support, right? To positionally protect. That was my protecting.
Like a splint. Almost.
Like a splint. I did elevate whenever I could. I did avoid I didn't take any anti-inflammatories. I didn't do any compression. I didn't have anything to compress with, but I guess
But the buddy tape a little bit.
Yeah, did it a little
Sure.
bit. And then forgetting the E for piece.
Exercise.
Oh, educate.
No, educate. There we go.
Educate.
Educate. I already knew what I was talking about, right? So,
Is that right?
well, let's say I didn't have anyone else to turn to.
Should have mashed over on our toes.
And then load, I did start to like, okay, what can I tolerate? What can I put onto my toe? I didn't keep all my weight on my heel, right? I started loading as soon as I could tolerate it. And I would load through my heel, then I'd load through my midfoot, then I'd load through my toe. Oh, I can't tolerate that yet. Okay, I'll avoid that for the next hour or two. Okay, now 2 hours later, can I do it now? Like, by the next day, I was able to roll through my foot fine. The bruising was going away. I could wiggle my toe. I was like, oh, maybe I didn't break it. And yeah, long story short, I did not break it. But point being, I was optimistic. It was going to be okay. Vascularization, I didn't have any heat source, but, hot showers, whatever, elevating when I could. And then last, exercise, right? I was sitting there trying to wiggle my toes. I was trying to do toe abduction, spreading my toes. I was alternating, pushing my toes down and up. That is foot exercises. So I was doing movements rather than avoiding it. And I felt 100% again, probably by 2 days later.
It's really interesting, like as you're telling that story, I think what happens when people get themselves hurt, they think there's something special that needs to happen. Mm-hmm. Do you know what I mean? Mm-hmm. And it's the same thing with like diet culture and exercise culture. Mm-hmm. People think that if I want to lose weight, that I need to do something special. I need to do something that no one else knows. It's a little known secret. It's this acronym of RICE. You know what I mean?
Yes.
Like it's this thing that no one knows,
right.
and that's special and fancy.
Right.
Yeah. But peace and love to me sounds like kind of simple, straightforward. I don't want to use the word common sense, but it's how it should be. It's not fancy. There's nothing fancy about it. And same thing like with diet. If you want to lose weight and you want to be healthy, simplicity.
Yes.
Yeah,
It's not.
It seems very like matter of fact. Almost.
Yeah, there you go.
Matter of fact.
There's nothing fancy going on here. There's no special plan. There's no special diet.
Right.
There's no special pill.
Right.
It's exactly as it should be.
Our business coaches use a term. You want it to be boring. You don't want it to be complicated. You want it to be boring. Keep it boring.
Yeah.
And, I think it applies to, like, since Cameron and I are both moms, but we're both in the medical field and we know a lot. But even when, like, your kid gets sick, like, you panic and you have that moment of, like, I don't know what to do. It's something special. Something special must be done, And then you calm yourself down and you're like, okay, I know what to do. I know these signs and symptoms. We can take care of this. But, yeah, keep it boring.
Yeah, that's great advice across the field for sure. They want overcomplicated. You use the word complicated. I couldn't think of that word a few minutes ago, but yeah, people think it should be complicated, and it's not. Mm-hmm. It's simple. Do what you can. Assess the situation. Obviously, get it checked out by a professional if you can.
Right.
But if you can't, do what you can.
Right.
Right.
Yeah.
Take it slow. Move.
Don't panic.
Yeah. Don't panic. Yeah. Stay optimistic. Right. All that good stuff. So. Awesome. Well, I really appreciate that. I mean, that was something that, obviously we work with very minor injuries in the gym and stuff like that. And sometimes, there's a good opportunity for me to be able to answer their questions, but, other times I've heard so many different things. So I'm glad that I learned about this peace and love thing now. So I'm happy to share that message and where it came from you guys. So
yeah.
Is there anything else that we should cover, whether it's about pickleball, about injuries in general, or anything like that before we wrap up?
I think, I'll just say that, what we said last time, which is what do I do when I'm dealing with an old injury that I can tell is coming back and it's becoming a problem, or what do I do when I have a new injury and I can't do what I want to do? Go speak to a neuromuscular expert, which is a physical therapist, and get assessed. We can sit there and tell you either, yes, we're going to need to work on this, or no, I could just give you a few exercises, or I could call up OTG and say, hey, I want them to focus on this during their next several training sessions. And then, you have answers. Don't put off getting answers.
Right. And I think it's important to keep in mind that even if you're not hurt, a lot of all the principles that you guys talked about today are things that should be done to prevent injury as well, especially if you're someone that is entering a new sport like pickleball. You've not exercised in a long time. You've not been in the gym. You've not played a sport. You've not tried running. You've not tried moving laterally. You've not done this stuff in a very long time. If you're not hurt, still implement some of these practices.
Yes, for sure.
Awesome. Well, guys, you want to maybe shout out websites and stuff like that real quick? Or Sean, do you have a question?
Yes. I have one more question before we start to wrap up.
Love your question, Sean.
We were talking about the importance of heat and kind of getting away from using ice as much. How do you guys feel? And I guess if you know some like more deeper research about it, the popularity of ice baths.
Oh, okay.
Dr. B.
Okay.
So the research is really showing that it doesn't expedite any kind of healing. It doesn't do much at all for the neuromuscular system. What it does do is it puts you in a fight or flight mode, and so then you get a mood boost. You're less tired because your adrenaline is pumping, so you feel really good because of that. And a lot of times you'll sleep a lot better that night because your body is now exhausted for being in flight or fight. But the research is showing that it's not doing much of anything for the actual healing process.
Yeah, because as soon as y'all had said it, like, it doesn't really help with this with inflammation as much. I'm like, oh man, I mean, everyone's getting an ice bath now.
It's a fad,
like,
okay. It'll come and go.
I'm more of a sauna guy anyway, so
I do like the sauna.
Yeah.
I love saunas.
Saunas are great.
Yeah.
Saunas are great. And like Dr. Cameron said, if you're doing it, it depends on why you're doing it. Are you doing it for the mental benefits, or are you doing it for healing, or are you doing it because you think it's going to help you grow bigger muscle? The research actually is showing if you're trying to do it for growing bigger muscle, you're actually kind of doing the opposite.
I was going to wait. My understanding of the research is that it actually blunts muscle hypertrophy
because of the lack of blood flow.
Or
ice bath.
The ice bath.
Okay.
Yeah.
Because you're not getting that blood
don't
flow.
talk about
That's
saunas
right.
around me, man. Crazy.
The ice baths actually stop muscle hypertrophy.
Yes.
Right.
So if your goal is to, when you get done working out, just feel better afterwards.
Mentally.
Sure, do the ice bath. But if your goal is to maximize your muscle growth, you actually shouldn't be doing the ice bath.
Right.
Or at least wait multiple hours later.
Right.
Yeah. And I'm not sure exactly how long, but just don't do it right after you work out.
Right.
That's my understanding.
Because something like a sauna, wouldn't that increase blood flow or no?
Right.
A sauna,
Yeah.
yes.
Yeah.
Yeah.
Okay.
As long as you're hydrating along with it, because you're going to be sweating a lot. But yeah.
Gotcha. Cool. Well,
Sweet.
That's all I had.
Yeah. Well, do you guys want to, any shout outs or anything you want to, website, social medias, future plans for the business, things like that? Anything you want to talk about?
Yeah, definitely. So please, check out our website. It's www.elevatedptwellness.com. Any of our socials, we are on all of them. We are on Facebook, Instagram, TikTok, YouTube. So our handle for every single one of those is Elevated PT Wellness. And then as far as plans, we've constantly got free workshops going on that we're giving to different communities. We're actually doing one this weekend on dry needling specifically. So follow us on the socials. Send us, a direct message on the socials with your email if you want to be added to our list. We email out. The only thing we email out is when we're having free workshops. So that's really the only email that you're going to get from us is, hey, we're doing this free workshop and it's on this topic and it's at this place on this day if you want to come. So, if you like free information.
Yeah, and I'm sure the topics change, right? So maybe it's about pickleball, maybe it's about dry needling, like you said, or it could be about anything. So each one is a different topic, so you could get that and then go check out the free event.
Right.
Mm-hmm. And we also offer a discount if you book a session with us at the event, then you get a discount.
Okay.
Yes.
Awesome.
Nice.
Well, guys, Sean, anything else?
That's it. I mean, actually, when are we going to get on the pickleball court?
Hey,
Yeah, you want to play some doubles? What's up?
I'm down.
Yeah.
I'm down.
Yeah.
We don't
You tell
have-
me when.
Yeah, I got the pro on my team, so I'm
Yeah,
good.
I played once. All right, y'all watch out. And I played 5 games, 5-0. 5-0.
So
Doubles.
Were you playing anybody? Was anyone else on the other
So
side?
you're basically the Serena Williams of pickleball.
Yes,
Like,
that's accurate. But we were
it
playing
looks
doubles, so
like
we were like
skill.
rotating teams. So like it wasn't me. It was Denver and I, and then some of our friends as well. So I had like good people on my team. all the time.
Well, next time you and your friends get together for playing, invite us out.
Yeah, for sure. We
Yeah.
actually need to order some paddles and stuff. We were talking about that because this is our first time we borrowed something. And it was really fun. So.
Hey, I know a guy.
Okay, I'm gonna call your guy. Well, guys, thank you so much for taking the time to share your information with us.
Thank you for having us.
Yeah,
back.
thank you.
For sure. And guys, we'll see you next time.
Peace out.